In this mobile footage, hospital workers in the KwaZulu-Natal province mourn the death of another colleague to COVID-19. South Africa is battling a second wave of the disease. So far, tens of thousands of healthcare workers have contracted the virus and more than 430 have died. The need for a vaccine is now more urgent than ever. So far, the government says it will get 1.5 million doses of the AstraZeneca vaccine by February.
At this point, we are targeting the minimum of 67% of the population to achieve herd immunity, and the approach will be a phased rollout of the vaccine beginning with the most vulnerable in our communities. And therefore, we would say, for example, broadly, the first phase has to deal with the issues of frontline workers.
South Africa expects to get millions more doses of a vaccine by the second quarter of the year to immunize 10% of the population. But that's still tens of millions short of what's needed to immunize the majority of all 59 million South Africans. This is despite running trials for 4 vaccines for months and planning to manufacture millions of doses for pharmaceutical companies. Professor SHABIR MADHI has been leading one of the trials at the Baragwanath Hospital in Soweto.
The notion that South Africa can vaccinate 67% of its population by the end of 2021, unfortunately, that's, with all due respect, very naive. For the first month, we would need to vaccinate 150,000 people per day, 7 days a week. From the second month onwards, for vaccines that require 2 doses of vaccine, we would need to vaccinate 300,000 people per day, every day of the week, until the end of the year, for us to get to 67% of the population.
The healthcare system is already overwhelmed and simply doesn't have the resources to cope with an extensive immunization program. Coming up with an effective vaccine rollout strategy is not the only challenge for the government. According to a survey for the World Economic Forum conducted in December, almost half of all South Africans say they won't take a COVID-19 vaccine. A new, more infectious variant of the virus in South Africa has raised questions about how effective existing vaccines may be. As South Africa faces a resurgence of COVID-19 that is already exceeding the first wave, experts are worried about a third and fourth wave, especially as vaccines for most of the country appear to be a long way off. Fahmida, Jazeera, Johannesburg, South Africa.